Good afternoon, good morning, or good evening, depending upon which part of the world you are in. I want to welcome everyone to this afternoon session. Doris Graeber, a very famous political communications scholar, wrote in one of her many books, in one of the books she wrote, how do people, ordinary men and women, tame the tide of information that is flowing at great velocity and volume at us? The interesting thing is Dr. Graeber, the late great Dr. Graeber, wrote this about 4 decades ago, anticipating what we today call as infodemics. In parallel to Dr. Graeber's work, when she was writing, the very famous Minnesota Community Studies team, Philip Titchener, George Donahue, and Clarice O'Lean, were talking about the importance of community and how to empower communities and how to take community-centric perspectives when we talk about information flows. And that too was a work that started in 1970s, much before we began the kind of conversations we are having today. Now, all of that has come together in the discussion, the current environment and discussion we are having about infodemics. Good afternoon. My name is Viswanath, and I will be moderating this panel on how communities prepare and respond to infodemics. Over the last day, since yesterday, we have been discussing a number of these ideas on this tremendous flow of information that is characterized by velocity and volume and variety of sources. How do people and communities tame this information and use it to their advantage? More important, how do communities respond to this, prepare for this, and react to this? So the panel today will build on these conversations, particularly the conversation before this panel, to examine interventions and approaches to prepare for and respond to infodemics in diverse communities. We will approach this conversation by talking about a few overarching issues. One of them is what has been called as communication inequalities, which is an idea that talks about inequalities in generation, processing, and dissemination of information, that is in health or in science, as well as capabilities to take advantage of information among different groups. Particularly in infodemic environment, there is a paradox, both a tremendous surge in information, maybe usually wrong information, and at the same time, information voids or deserts where the right information may or may not be present. So the equity and equitable access becomes central. In fact, it has been an idea that has been coming around and that's been discussed throughout a number of sessions in this workshop. So this panel will examine all these issues, but from a community-centric perspective. What you see is a very rich set of experiences that our panelists bring today to talk about how they and their communities have handled the surge in information, especially during emergencies. And we could not have found a more incredible group of panelists with tremendous expertise straddling both academy and frontline on the ground work. For more detailed information on their backgrounds, please check the link on speaker bios. I can't do justice to them, but briefly, we will start with Amanda Boyd from Washington State University. She will be followed by Dr. Jill Jim of National Indian Health Board. Third, Juliet Choi, President and CEO of Asian and Pacific Islander Health Forum. And the remarks will be wrapped up by Dorothy Oliver, community advocate from Alabama. They will take about 5 minutes to make their remarks. Then we will open it up for conversations. So to the panelists, as has been reminded, speak slowly so that our translators can stay with us as they do this. So we'll start with you, Amanda. Thank you.
Well, thank you for that introduction, and hello, everyone. It is such an honor and a privilege to join this panel on preparing for and responding to infodemics in diverse communities. So I am Danae Za, and a member of the Métis Nation from Treaty 8 territory in Northern Canada. I co-direct the Institute for Research and Education to Advance Community Health, which is a large health research institute. And we work with over 150 Native nations and organizations and are dedicated to improving the health and healthcare of Native people. So when I think of preparing for and responding to an infodemic in Indigenous communities, I want to make sure I touch on 4 points. The need to work with Native communities, messaging from trusted sources, social listening, and understanding the information environment, as well as building relationships before a crisis occurs. So my primary point in preparing for and responding to an infodemic is to work with Native communities. Success in many cases will be dependent on honoring the experience, expertise, and Indigenous knowledge that is already in a community. People will generally know what works in their own community and will be able to lead or facilitate messaging. So our work has shown that one of the most common factors in successful health communication campaigns in Native communities is that the affected population was involved in, or better yet, led the communication effort. Inside individuals are more likely to understand the effective channels used for health messaging or the barriers to communication, and each community or region may be different. So COVID-19 really inspired some creativity in communities, because for Native people, we often meet in person. And I know as an institute, we do a lot of our health programming and messaging face-to-face. So in a crisis where we couldn't do that and we couldn't meet in person, it was important to determine what worked best for each community and group. We found that a lot of communities and regions rely on radio, some with good internet, preferred social media. So communities generally have the best idea of what will work for them. Furthermore, when you work with communities, people can incorporate cultural and traditional norms in communication processes and messaging, especially when it's considered inappropriate for others to do so, particularly outside people out of the community. Outside agencies and researchers, they may not have access to local knowledge or be aware of the behaviors that even affect the exposure to a hazard, and may not understand what affected parties care about. So if we work with communities, messaging is more likely to be trusted, which brings me to the second point, working with trusted individuals. And so I know that this is important in any communication, in any population, but it's particularly important with health messaging with Native people. There is a history of distrust of outside messengers, researchers, governments, and organizations, and this distrust is not without reason. So working with trusted individuals is critical, and we find that these are often interpersonal sources. This can be tribal elders, medical professionals, particularly Native people, or those with relationship with community. To provide a tangible example, one of our COVID-19 health communication case studies was with the Nez Perce Reservation. Their medical health director is Nimipu. She got her MD, moved back to the Nez Perce Reservation, and during the pandemic, she did Facebook Lives to provide messaging about physical distancing, information about vaccines. People in the community talked about how trusted she was and how much they relied on her messaging to make decisions. So determining who is trusted and working with these people is critical. And so my related third point is listening to what information is in our communities and how information spreads. So in our work throughout the US and Canada, we know that social listening and understanding the information environment in our communities is really important. So, for example, with COVID-19, Native Americans had some of the highest vaccination rates in this country, but that doesn't mean there wasn't misinformation. As with other populations, we saw concerns about mercury in vaccines, side effects, concerns about side effects, including infertility. From listening sessions, we heard concerns that were more related to Native populations as well, such as vaccines in particular would affect Native mRNA, or that traditional medicines were enough to protect people without a vaccine. In case studies in Canada, we found that trusted individuals could provide health information that encouraged social distancing or physical distancing and getting a vaccine. But in one case, we found very low vaccine rates in one community. Health researchers or health workers found the trusted elder had a dream that the vaccine would end the death of many people and was warning people against vaccination. So misinformation does happen. So having the resources on the ground in the community so that there's an understanding of what is going on is really critical. So preparing for an infodemic means the co-creation of communication strategies and strong engagement using culturally appropriate messaging that is meaningful to Native people. It means building relationships before a crisis happens. These relationships can take years to develop. So that's why it's so important to build those foundational relationships before there is any kind of crisis. So preparing for and responding to infodemics means working with communities, building relations long before there is a crisis, and honoring Indigenous knowledge and expertise in health communication. So Miigwech, thank you. I am looking forward to hearing the other panelists.
Thank you, Amanda. That was very nice. We'll next go to Dr. Jill Jim. Jill?
Yes, I'm Dr. Jill Jim. I am with the National Indian Health Board, and I just wanted to speak a little bit about information channels that do or do not work in Indigenous communities. And a lot of things I want to also reflect on represent many tribes across the tribal nations across the United States. And it really relates to broadband technology at times. We know that's an issue across rural and remote communities across the United States. And one of the mechanisms that we felt like are certainly important to consider when working in Indigenous communities is radio. Their radio is more reliable on the tribal nations and reservations. And so the messaging also has to target the different population groups. For example, if it's youth or elders, and that possibly has to include translation of the health messaging in order to combat misinformation. I think it's very important that it also comes from health professionals. Other sources of information are local newspapers. A lot of people and tribal communities still rely on local newspapers. And then in some cases now there's online newspapers such as Indian Country Today, and people still subscribe to those. So having national representation from tribal communities is very important. And also looking at social media as well. And it really depends on the age range, as I talked about. Some young adults might be more prone to looking at TikTok or Twitter, and then there's Facebook messaging. So those were a lot of things that we used on the Navajo Nation as a former health director during the pandemic as well. And also hospitals rely on sort of their own videos and the creation of those in their waiting rooms as well. Those are also very important. Many tribal health facilities and Indian Health Service facilities also rely on creating their own information in their waiting rooms, as that's a source of people receiving healthcare as well. Some things, as I mentioned, may not work as people going to the web pages or websites just because of technology. And I think that might just be another difficult situation when I talked about internet access as well. So I think looking at radio and the radios, and as Amanda mentioned, what is available in the communities. So I think those will all differ across the United States, and especially in rural and remote communities. So I just wanted to leave that message with everyone, and also very importantly, just relying on credible information directly from health professionals are very important for people to gain trust in receiving information about any health information. So thank you very much. I'll end there.
Thank you, Jill. We'll come back to you with some questions. Next, we'll go to Juliet.
Great, thank you. And thank you everybody for joining this conversation today. My name is Juliet Choi. I'm the president and CEO of the Asian and Pacific Islander American Health Forum. We're the oldest, largest health advocacy organization advocating on behalf of the Asian American, Native Hawaiian, and Pacific Islander communities across the country and the Pacific jurisdictions. This is such a critical conversation, and thank you so much for hosting this forum. When I was thinking about what I could highlight today, especially in this context of infodemics, I also wanted to highlight a couple of other dynamics that were playing out, especially during the COVID experience. And let me start from a perspective about misinformation and highlight misinformation about our communities, and then also highlight a little bit about the impact of the misinformation within our communities. So the misinformation about our communities, as folks can appreciate, there's just incredible diversity across Asian American, Native Hawaiian, Pacific Islander communities writ large. We all know the devastating harm of and the tragedy of COVID, but we also know, we experience firsthand how hate language, especially the China virus, had an incredibly devastating additional impact for our communities. So hate and violence, of course, invoked fear within our communities. And right at the get-go, we found ourselves in a situation where we needed to combat the misinformation about the China virus and the hate towards our community. We worked with our partners to rapidly create toolkits and information and messaging to let our own communities know that despite the fear that there are advocates available, that despite the fear that there was added support so that folks could step out of their homes safely to seek the care, to seek those precious vaccinations early on. The second misinformation that our communities continue to battle against, quite frankly, is a model minority myth. There are so many within our country where the dialogue continues that Asian Americans and Pacific Islanders fare equally or fare well compared to their white counterparts. And we know from research, this just is not the case. The devastating impact about one aspect of the model minority myth is that very precious resources, limited resources, end up being distributed towards communities of color, including the Asian American, Native Hawaiian, and Pacific Islanders. Now, shifting briefly to the misinformation that was percolating and continues to percolate within our communities, of course, I need to highlight that given the diversity of our population, immigration status, I did want to ground that 1 in 4 Asian American, Native Hawaiians, Pacific Islanders speaks English with limited capacity. When you break that down by certain demographics, believe it or not, more than 40% of adults within the Chinese community, Bangladeshi, Vietnamese, Nepalese, Burmese do not speak English very well. Let me underscore that again. Over 40% of adults in those communities do not speak English very well. So when we think about misinformation and balancing that with trying to get the right information delivered in the right way to our communities, we're facing quite a few challenges systemically. There is a lack of support to ensure that there are avenues to counter the misinformation, and there are a lack of channels and an infrastructure to ensure that the right information gets to our communities. Some of the misinformation that was percolating within our communities, and I appreciated, Amanda, the stories that you highlighted, included messages, misinformation, such as folks could get COVID from the vaccine, that DNA will be altered, that the COVID vaccine would cause fertility issues, that it's not safe or effective, and that it's costly, that the COVID vaccination actually required proof of identification or health insurance, which we knew was not correct. So shifting to how can we combat misinformation and mitigate, I actually want to say mitigate against misinformation, because I think we're always going to have to deal with these types of barriers when it comes to combating misinformation and getting the right information to our communities. These are all themes that we know really well, but it is building an infrastructure of trusted messengers, being able to provide information in a culturally relevant way and in language. I cannot underscore enough, if that language accessibility component is not there, we are just not going to be able to communicate with our communities. Thanks to partnerships with the private sector, also with CDC, what we did at the Health Forum, thanks to our network of community partners, we actually created our COVID Response Partnership, which is a national partnership of over 40 community organizations at the local, regional, state, and national level. Some of the successes that I did want to highlight, making sure we brought in trusted messengers who would know what kind of messaging would resonate with our communities. We were able to produce over 400 products in over 35 Asian, Native Hawaiian, Pacific Islander languages. Technology helped us, social media helped us. I think there are terrific learned lessons and successes to celebrate, but certainly a lot of room for innovation and room for growth. We tried translating certain videos into 9 Asian, Native Hawaiian, Pacific Islander languages. We also embarked upon doing Zoom sessions and with simultaneous interpretation. And as you can imagine, again, there are a lot of successes there, but you can appreciate the kind of resources, investment, and infrastructure that's necessary to be able to communicate to over 25 million Asian Americans, Native Hawaiians, and Pacific Islanders. And I think some of these challenges and successes are really very relevant in so many more of our immigrant populations. Again, nothing will replace the ability to make that one-on-one, high-level connection and touch point within community. So what Amanda and Jill have highlighted, having those trusted partners, building those partnerships in advance of a crisis, in advance of a pandemic, is going to be critical. I think collectively our communities have built a really tremendous infrastructure, but I do want to touch upon some of the challenges going forward. We all do know that there were great investments through COVID. We also are now experiencing dwindling resources with COVID, the diminishing impacts of COVID. But I think as a country, as a public health community, as communities of color, what we need to ask right now is, how do we sustain the investments that have been built so that the infrastructure, the partnerships, these kinds of dialogue do not sunset now, but rather we continue to invest in our preparedness community so that with the next crisis, we are that much more prepared and able to respond to our community needs that much more quickly. I'm certainly looking forward to hearing from Dorothy and the rest of our discussion today. Thank you.
Thank you so much, Juliet. So that was very helpful. I already have a lot of questions to keep this conversation going. So we'll take 5 minutes, hear from Dorothy from our wonderful experience on the ground, and then we can start the conversation. So Dorothy.
My name is Dorothy. I'm from Panola, Alabama, retired from waste management for over 30 years. So, and still have a job. So I'm continue working in my community. I worked with COVID-19 and made sure that I got 99% of my people vaccinated during the COVID when they got the vaccines out and everything. So I made sure that I went, if it took making phone calls, that's what I did. And because I listened to some of the others that spoke before me, it's important. Communication is important because if you get that right and another thing, not just communication, the right communication is important. So we worked in my community and we went, if we had to, what we did, we went door to door to make sure that we talk to people, communicate with them. And I found out another thing, you gotta go to them in a calm way because people are too quick to get upset and kind of, thinking you kind of demand something for them to do. So what we did, and I worked with my commissioner, and thank God, because it's important to have a local leader. When you got a good local leader to work with you, that helps a whole lot. And we made sure if it was important if we needed to go to the churches, we went to the pastors of the church and made sure we got information out. I work at a little convenience store that I own now since I retired. And I make sure that I put up flyers up. If we got something going on, we got a COVID-19 site for next week or the next few days, I make sure I communicate with people as they come in the store and also make sure we pass it out to different churches. So I think communication is really important. So, and they did as we went along and did door to door and on phone calls. So they actually made a 16-minute document film about how we got the people vaccinated in this small rural town of Panola, Alabama. So that was my comment.
Excellent. Thank you, Dorothy. I'm going to come back to you with some specifics. You had some great pointers for us in our conversation earlier. So what we will do, I have some questions to start with, and there may be questions coming up from the audience. Matt, can you take the slide out? Okay, thank you. So one question that was evident and that came through your opening remarks were this tension where there has been a history of discrimination and continuing current racism. So there is a reason why people can distrust outsiders, because of that history. And I think, Juliet also gave examples of current reigning discrimination. So the question for me is how do we account for it? How do we take into account? Sometimes it may be intentional, as we have seen with COVID-19. Sometimes it is unintentional. How do we account for that history? How do we take that into account as we develop our communications? So maybe Juliet will start with you, and then I can go to the rest of the panelists.
Sure, that's a great question. It's a really big question. I will share from, for us, especially with the anti-Asian hate, it was really important for us at the national level to be able to call out the issue and highlight the impact of anti-Asian hate and actually demand public support and those who were proliferating the terrible messaging to end that. We've talked about community partnerships. For us, it was also important that we strategically partnered with the National APA Bar Association, which is the largest organization of judges and lawyers for the AA NHPI communities. We also brought visibility and light to the issue talking with our federal partners, including HHS and the Department of Justice. So I just want to highlight that because, when it comes to this country's history of racism and discrimination, it's very, very real. And I think there are different ways where different advocates and different leaders can come together to bring visibility around those issues. We certainly cannot do it alone. The Health Forum, we also work in coalition with many other civil rights organizations like the NAACP, the Urban League, Unidos US, National Congress of American Indians. So I highlight that because at the local level, I think it's important for our communities and families to know and understand that there should not be shame if you encounter hate or you're discriminated against, and that, it's quite an American thing to talk about your individual rights. And I think culturally, sometimes our communities don't always feel comfortable raising those issues. So that's a little bit of information that I wanted to highlight, and certainly appreciate the question, Vish.
Thank you, Juliet. That was very instructive. Dorothy, how about you? You had to, it's so interesting. You went virtually door to door and having these conversations. I'm sure these issues of racism, discrimination, those issues have come up. How did you handle them? So,
Yeah, thank you. That's a good question too, because they definitely came up in a lot of cases. The way I handle them when they come up, and they definitely came up because we actually went door to door, and going door to door, you're gonna meet all type of people. You're gonna deal with the Black, the white, the Asian, all types. As we was going door to door. So way I handle it, I just, like I said earlier, I just talk to them and try to stay in a calm manner, and then I try to explain, we all got to show love, no matter who you are, and then when I finish with the conversation, I'm gonna let them know, we love you now. A lot of people, some of the problems, and this person think this person don't want you over this way, how I work in the community. So what I do, I try to just talk to them and then let them know that we family here in Panola. And that's where I feel. And by me working with them and working in this community so long, now everybody kind of look up to me and know that I'm a serious person and I'm gonna do what I said I'm gonna do. So I try to handle it, just communicating with them and let them know, give them the right information and make sure that way they're gonna trust you because they know you're giving them the right information. And that's the way I handle it.
That's great. It's interesting. In the morning conversations, the issue of humanity and showing humanity came up, and your expression or word of love, I think, makes so much sense. And at the end of the day, Amanda, what do you think?
Yeah, I would love to comment on that. I think it's so important to understand the history behind racism, particularly in this country and when we do any kind of communication, because that is going to be one of the fundamental challenges that we are going to face. In numerous of our conversations that came up, the history and the spread of disease came up often. And so if people need to understand the history of racism and genocide and how that will factor in people's perceptions of the risk of a disease and how we can better communicate about it as well. So knowing that history is really important.
Right. Thank you. Jill, do you want to weigh in on this?
Thank you. Yeah, I agree with everyone's comments. And as I remember in our experience with COVID in our own community, there was a lot of misinformation targeting the American Indian population at one point. Regarding more like transmission in neighboring towns. And I think a lot of communities deal with that. Just because there's higher cases in one area doesn't mean we're the ones spreading the disease. And I think engagement of tribal leaders at the time to speak on behalf of the entire population and advocating to address racism is very important in these situations. But those are sort of the situation that we dealt with. But combating and dealing with the comments in a very direct way and working with leadership is important in communities to try to tackle that as much as we can. But we know outright that that wasn't the case. So I think tackling misinformation immediately, I think, is going to be very important in engaging our leaders in our communities. It doesn't have to be elected leaders. There are many leaders in our communities that can address it.
Thank you. So most of us, as we think of this idea or a construct or a concept of infodemic, somehow think of tremendous volume or surge of information through internet, social media, and these so-called new technologies. But each of you has highlighted the importance of local media, or as one person said, legacy media, local newspaper, local radio, door-to-door conversations, telephone. How, I'm just curious, whenever I actually in my research presented the idea of digital divide, no one takes me seriously because they think, internet has penetrated everywhere and it has solved all the problems. But how do we make sure that we understand and use these local so-called legacy media like local newspapers and radio, or these interpersonal communications and organizations like churches as we try to cope with these infodemics? Shall we start with you, Amanda, and then I can go to Dorothy because she has done some interesting things there.
Yeah, sure. So this is one of the things that I think that came out very strongly, especially with around COVID-19, where we saw that local media and local sources were so important for numerous reasons why we've heard in this panel. They're often more trusted. A lot of people know what's happening on the ground in the communities. And so working with these local sources is so important. And we found that there were ways with Infodemic, as you said, that there's so much information. Local sources were figuring out ways to sort through all of this information to make sure their communities were getting the information that they needed. So we saw things like community task forces being developed to go through all of the information to try to understand, okay, so what are we going to highlight, especially from a community? And so these local sources, I think, were so important and I think are going to be really important as we move forward with understanding how to do this.
Thank you, Amanda. So Dorothy, you had what some of us have, some people have called as hyper-local approach. You know your community. You have been there. Whether they came to your grocery stores or you went from door to door or you worked with churches. How did you come up with this local media angle, and what did you think about it?
How I came up with it when they got ready, just when it got, people started, getting sick and all that. And I guess I had to go in prayer because I knew I had to do something for my community because we live in a rural community and you don't get a lot of help in this community. So what I did, I just went to bed at night with it on my mind, get up the next morning with it on my mind. I said, Lord, what can I do? And before I knew anything, I was making phone calls to make sure people get their vaccination, and making sure that they get a way to go to get their vaccination. So it's just important if somebody, everybody, a lot of times people wait on the next person to do. So somebody just got to take charge and talk to people and get other people to help out and try to get it done. Because you don't get it done in rural communities. You got to have something like that because you won't ever get anything done. So, and I thank God that He put on my heart to do this, to go door to door, to get on the telephone, to get in my own car, use my own funds, to go and to help somebody.
Mm-hmm. Thank you. And Juliet and Jill, you have this tension where you're heading these national organizations. But again, because of the diversity, you do have to look for the local angle and local media, given the diversity. So how did you handle that? So maybe we'll start with you, Juliet. No?
Sure. I saw Jill take her mute button off. For us, I think the contribution national organizations like ours can offer is the opportunity to facilitate bringing different community groups together. So I don't want to suggest that national organizations will always have all the answers. I think we certainly can have a bigger voice when it comes to Washington, D.C. and Capitol Hill and the White House. So especially for COVID, again, I want to highlight the health response partnership that we were able to create and convene, which, started with about 20 partners, and now it's over 40 organizations. And I like to describe it as a network of networks. The national partners bring all of their networks to the table, and really looking at, when we appreciate how the face of our local communities are changing so rapidly. Salt Lake City in the state of Utah, for example, now has, my understanding is, the largest Pacific Islander population in the continental U.S. So, I'm not going to be able to reach Utah, but we know that there are growing and emerging local organizations. So I think our opportunity and responsibility is to create those pathways so that local community groups can connect up to national groups. And I think what COVID has also taught us, it certainly taught me, that even in moments of crisis, the need, the desire to connect with one another is incredibly powerful. So the Health Forum as a national organization, before COVID, we were a network of about 90 organizations across the country. And right now we're at about over 170 groups. So all the outreach efforts that we've talked about, communications, I think it's really important, particularly for communities of color and immigrant communities, rural communities, the LGBTQ, the disability communities, for all of us to make sure we find more and more pathways to build these bridges to one another, because there's more power in the many than alone.
Right. Thank you. And Jill, you have the unenviable challenge. You may be at the national level, but you also have audiences who are dispersed all over the country, urban and rural. How did you manage that?
Well, I think our organization did a good job connecting with tribal nations. I mean, a lot of the information that we were receiving and putting out in the community, we work with the different tribal leaders that are representatives on our board. So a lot of that information, like Act of Love, is still a very strong campaign off of COVID. And I mean, just the semblance and branding and marketing materials like that were very effective in getting materials out and building a webpage, a COVID webpage where people can go to and receive resources. So we were the hub for many of the tribal communities that wanted to see what was happening nationally, and then also a liaison to federal agencies and Congress as well, and advocating. So I think we were in the right position to continue to be available to provide information, but also relay the importance of that by receiving information from many of the communities and leaders as well.
Wonderful. Thank you. Questions are still coming. I have 100 questions here. Unfortunately, we are out of time. We want to stay on time. But I want to thank the organizers as well as the panelists. It's incredible, the richness, both the breadth and the depth of the experiences each of you brought to the table, and sharing your ideas with us. I'm so grateful to you. Thank you so much for doing this. I'm sure we can continue to talk about it in other fora. I want to pass this on to my colleague, Dr. Tim Collins, to take care of the next panel.